Hello, everybody. Welcome to another Holistic Health Hour. And I'm Dr. Kevin Cutters, your host for the next 30 minutes or so, where I try my best to answer questions we have a discussion about your health, maybe, or your friend's health, and activate the chat. So you can feel free to chat in your questions. However, those who have sent in questions on holistichealthhour.com, I can answer those first. Got a bunch that came in. I haven't done this for the last couple of weeks. I've been too busy, so it's, there's going to be some sporadic issues with doing these weekly, just depending on my schedule. So apologize for that. And I always go to holistichealthhour.com where you can ask the questions. You can post your questions there, um, and you have a better chance of getting them in. Feel free to chat in questions. Right now, let's get to your questions. First of all, is soy not safe for cancer even if it's organic? So, first point is that most soy, that this person obviously probably recognizes, most soy that's grown and sold in the United States is GMO soy, which is not good for anybody. So, if it is organic, is soy okay? Okay, so soy is going to be an endocrine disruptor. It's going to have estrogen properties, and it can be a problem for everyone, even if a person doesn't have cancer. So, certainly, if you have cancer, it can be a worse problem, and most importantly, it can be a bad problem for those with cancer that is hormone driven. So, if you have an estrogen driven or progesterone driven cancer, then soy, I would say, is completely out of the question whether it's organic or not. It doesn't make any difference. If you don't have cancer, is soy okay if it's organic? I would still say probably not. We're exposed to so many um, xenoestrogens, that's estrogens and estrogen like products from our environment that throw off our hormone balance, that soy should be generally a no-no for everybody, whether it's organic or not. Is soy in different products a bad thing? There's different soy isoflavonoids in different products. Is that a bad thing? Well, not always. So if a person is going through menopause and they're trying to balance, they're having horrible symptoms and they're trying to balance their estrogen, soy isoflavonoids can be an extremely beneficial piece to that. So I'm not against using it wisely as a medicinal approach to things. There's there's research that genistein can be fantastic for ovarian cancer and other hormone-driven cancers. And then lastly, I'll say about soy is that not all soy is equal as far as if it's fermented soy or not. So a fermented soy, which would be in some traditional Japanese cuisine, um, but a fermented soy acts completely different than soy does, the non-fermented soy. So fermented soy is actually a treatment approach for different cancers that are estrogen driven, because it's been found in different studies that fermented soy actually dislodges bad estrogens as they attach to the estrogen beta receptor of cancer cells, and that's a big problem that with in estrogen driven cancers. So fermented soy is completely different than non-fermented soy, and there's only a couple products on the market that actually have fermented soy, so you would know what you're getting. However, if you're eating traditional Japanese cuisine with fermented soy, that can actually be protective of cancer if you don't have cancer, and can be beneficial for those who have an estrogen driven cancer. And then lastly, like I mentioned, um, soy in a non fermented form is going to traditionally is going to be in the United States. It's going to be most commonly found in a GMO form, which is not organic. And organic soy is still going to be an estrogen-like substance, it's probably not a good thing for anybody. Now, if it's in a few different things that you're eating, some soy in it, it's probably not going to be a problem. But a lot of vegans will substitute soy for meat, thinking that it's healthier for them, and it's by far not healthier. It's a much poorer substitute. Okay, next question. I have been on your ADK Complete. So ADK Complete is a vitamin A, vitamin D, vitamin K. I think there's some vitamin E in it too. For a few months, it's all the fat-soluble vitamins. As I was unable to get my vitamin D level up on another brand, in the last 2 months it has gone from 30 to 36, which isn't a big rise, with one pill a day. So one pill a day of the ADK Complete is 5,000 IUs of vitamin D. I can't remember how much of the other supplements, the other vitamins it has in it. But should I double my dose or stay on the course? I would double the dose of that. Sometimes people need to be on 10, even 20,000 IUs of vitamin D to get their vitamin D levels up, which brings up another question. Why would a person have difficulty getting their vitamin D levels up? It can be multiple different reasons. It can be absorption issues. So if you have a history of gallbladder issues, that can be, you can have difficulty in absorbing your fat-soluble vitamins. You can have a damaged gut causing issues in absorption of fat-soluble nutrients. Probably the most common reason why a person has a sluggish ability to get their vitamin D levels up is that they have defects in their vitamin D receptor genes. So there are specific genes that help you absorb and utilize vitamin D. If you have a lot of defects in those genes, it can be more difficult, so you just need to take more vitamin D. Next question. I have been doing coffee enemas nearly every day, Rife treatments, supplements, including binders. I previously expelled a lot of liver flukes. I went a while not seeing anything, and now I'm expelling worms. How do I know if I got all these parasites up? Well, there isn't, like I've always said, there isn't any perfect labs out there, but doing a comprehensive stool analysis test might be in order. I don't know that you would need to do that. I mean, if you're able to see that you're expelling parasites, I think I would just keep on track of what you're doing and keep track of, trying to view them. I know that's kind of grotesque for a lot of people that might be listening, but if you're trying to get rid of parasites, you want to get rid of parasites. And if you can see them and know that you're expelling them, all the better. Comprehensive stool analysis tests, I think they're about $300-400. And they're certainly not perfect like any other test. I've had people that know they have parasites, and that the stool parasite test comes back negative. Because it's only measuring, a small portion of your stool at that specific time, and if things can get missed. So I would just stay the course. That's all what I would do. I would just stay what you're doing. Next question. For someone with skin cancer, would you still recommend that it's beneficial to get some short time daily of beneficial sun on the spots, on the skin cancer spots? Of course, not burning. I have heard that from natural doctors that it can be beneficial, but dermatologists almost forbid people to get out in the sun and recommend using daily sunscreen or staying inside. So I don't think the sun causes cancer. So the sun does not cause cancer. It's not just what I think. It just doesn't. However, sun burns can cause cancer. So a burn, the sunshine, you're getting radiation from the sun, right? So not all radiation is bad. It's excess radiation that causes damage to cells that can then lead to cancer. Whether you're getting multiple x-rays at a doctor's office, you're getting radiation therapy, let's say for breast cancer. There's many people that get radiation therapy on soft tissue, post lumpectomy on breast cancer, and then several years later they end up with a melanoma at that site. Well, because that radiation damaged the skin just as much as you went out and you were a sunbather, addicted to sunbathing, and you burned often. It's the burning, it's that damaged skin that can lead to cancer. So going out and getting some sun is the right thing to do. Now, I know different people have different skin types, and I personally have the type of skin I never have ever worn sun uh, screen ever. I just don't burn. I mean, I will if I go out and, if I go to Florida, from maybe in Minnesota and Wisconsin, go down to Florida in January, and you haven't been out in the sun for 3 months, and I go out and let myself be scorched. But if you wear a hat, you protect yourself. That's the idea. But I just don't burn easy. All summer long, I am outside. Never do I rarely ever burn. Other people have more Scandinavian skin type, and they just burn really easy. So they have to be careful. Now, if you're going to use a sunscreen, I'd use a natural sunscreen. The sunscreens that are out there on the market that you buy in the grocery store or at Target or something are far more cancer causing than they're cancer preventative. So make sure you're getting a natural sunscreen. We just started carrying some products of natural sunscreen that are really good. I haven't used them because I don't use sunscreen, but my kids have used them and had a lot of really good feedback from people who have purchased them. I live in northeastern Montana, where there are very few holistic doctors. Most of them don't even check my adrenal health or know what the saliva test is. Okay, I think this person's talking about the salivary cortisol test. So there's an adrenal stress test, adrenal health test that's testing salivary cortisol over a period of a 24-hour period. I think that's what they're talking about. About 6 years ago, there was a naturopathic doctor who treated me for adrenal fatigue. It was very helpful, but she's no longer there. I think I need to test for cortisol levels again. My question is, will Dr. Connors be willing to work with me on the phone or email from a distance? Okay, the answer is that. So that is yes. You can just call our office and schedule an initial consultation with me, or you can just go to our website, hit schedule now, and you'll go to a schedule page, and you can self-schedule yourself. Easy peasy. Next question. I have chronic Lyme. Would a Rife machine be a good investment? So anybody who's followed me knows that that's probably big reason why a person would follow me is their interest in Rife technology, because we've been using Rife technology for 20 some years now. 25 years. It's 25 years. Yes. It's 25 years this summer. Wow. First time I thought of that. A Rife machine, who, for those who don't know what that is a light frequency generator, and it's used to stimulate the body at different frequencies. What's the best? So again, any therapy tool is just that. It's a tool. And any tool needs to be used correctly. You could use a screwdriver to hammer a nail in, but it's not going to be very effective. You could use a hammer to hammer in a screw, but you've lost the benefit of the screw. Now you're just using it as a nail. So you want to use a tool correctly. Let's say my main issue was heavy metal toxicity. That was my main issue. Which nobody just has one problem, right? So would I buy a Rife machine to help me detox heavy metals? Well, yeah, there's benefits to a Rife machine to help you detox, because you can run liver frequencies, you can run, detox protocols and different things with the Rife machine. But I would do other things, maybe even more so before I would invest in a Rife machine for my heavy metal toxicity. But if I have Lyme disease, if I have cancer, if I have a chronic infection, which ties to many autoimmune diseases, um, definitely a Rife machine is a good investment. So a Rife machine uses light frequencies to help your body kill different things. So it can help your body kill cancer. It can help your body kill Lyme disease, which is Borrelia, Bartonella, uh, and other co-infections that go with Lyme. Can help chronic viruses. Um, we used Lyme a lot at this last quote unquote pandemic. It can be very beneficial to help protect your family. It's a great tool. You feel like you're coming down with something. I think everybody would be benefited to have a Rife machine in their home. But if I had an issue like cancer or chronic Lyme disease, absolutely you should have a Rife in your home. It's with chronic Lyme, the difficulty is most chronic Lyme moves to what I call phase 3, which is an autoimmune phase. So once you're in an autoimmune phase, you already have your body has made antibodies against self tissue, and if once your body makes antibodies against self tissue, now you have a bigger problem because you can't kill an infection using normal means that a person would want to kill an infection from a natural perspective. So, if I have an infection, I would take certain nutrients, certain herbs. Let's say I take echinacea and garlic to kill this infection that feel like I have this lung infection coming on. I take echinacea and garlic, and maybe I would take some different mushrooms. Cordyceps is really good for the lungs to help kill this lung infection, and it knocks the lung infection out. Well, a chronic infection like Lyme, which is a chronic infection, not an acute infection, if it leads to you making your body's immune system making antibodies against self tissue, and you take things that will stimulate an immune response, you can actually make yourself worse because you'll kill that which you have antibodies against first, which is self tissue. So you're going to kill self tissue by stimulating the immune system by taking echinacea and garlic and cat's claw and things like that. Things that you normally use to help kill Lyme, you've got to be careful in consuming those things. Well, how do you kill a chronic infection if you can't take immune stimulants to kill a chronic infection? Well, that's where the Rife machine shines. So a Rife machine isn't using immune stimulants. A Rife machine isn't stimulating your immune system. A Rife machine, programmed correctly for chronic Lyme, is killing directly. So then you're not killing self tissue. You're not stimulating your immune system to kill self tissue. Let's say you have antibodies to your thyroid. So you have Hashimoto's, maybe produced by the Lyme disease, maybe produced from something else. Plus, you have a chronic infection, and you take a bunch of immune stimulants to try to kill the chronic infection. You're going to make your Hashimoto's much worse. You're going to damage the thyroid gland. You're going to kill thyroid cells. You could end up in a hyperthyroid issue with a Graves' disease. You could end up with just greater Hashimoto symptoms, unable to get that under control when it's been under control for a number of years. All sorts of problems can come up. So a Rife machine doesn't do that. A Rife machine is going to kill directly. In doing so, it's not going to kill your self tissue. It's not going to stimulate an immune response that's going to generate damage to self tissue if you have self tissue antibodies. So, long answer to I have Lyme, chronic Lyme, would a Rife machine be a good investment? But the answer is yes. Next question. I have been taking my son to a naturopath for several years trying to detox heavy metals. We've done so many protocols, but his heavy metal tests still show high. What is wrong? So, um, so first of all, there's how do you measure if a person's got heavy metal toxicity? There's really two different tests to do. There's a hair analysis test where you take a hair sample, you send that in, and they test for heavy metals. Or there's a provocation test where you take a bunch of chelators, you kind of OD on chelators, which pulls a whole bunch of stuff out of your tissues into the bloodstream, and hopefully you'll excrete more. And then you do a 24-hour urine test, and you measure the heavy metals in that 24-hour urine sample. Now, the issue that I have issues with both those tests. Number one, the hair analysis test is not super accurate. But again, no test is going to be perfect. The provocation test, I have even more issues with it because you could actually make the person sick, because they're not going to be able to excrete all those heavy metals, and it's just going to circulate and be deposited somewhere else and cause more issues. So I don't like either one of those tests. If I had to choose one, I would do the hair analysis test. You can order that on our store if you're a course member. But the truth is that we all have heavy metals. So do we need to do the heavy metal hair analysis test? I don't think it's a need to do test. You could assume that a person has it. So to get to the answer to this question, what is this person doing wrong if they're doing different protocols? Well, I don't know what kind of protocols this person is doing, but many times you'll go to a naturopath, get tested for heavy metals, and they'll go right to what are called chelators. So chelators are things that grab onto stuff in the cells or in the tissues and bring it back to the blood so it circulates through the blood in the hopes that you're going to detoxify it. Now, you're going to get rid of it. The end point of detoxification, remember, is the toilet. So the problem is I call that phase 0 when you're chelating stuff out of the tissue. You have 6 other phases that you have to do first prior to that. Many times when people aren't able to detoxify quickly, they could be labeled, historically, they're labeled slower detoxers. It's because they have issues with, most commonly, with phase 1, phase 2 detox pathways in the liver, and most commonly to that, the issues are genetic. So if you have genetic defects on your cytochrome P450, your PONT pathways, your NAT pathways, you're going to have slower, detox ability. So, and then the liver is going to get clogged quickly. There's other reasons too. A person can have an overwhelmed liver because of a whole bunch of different reasons. But that is probably the most common traffic jam that we have in the whole detox pathways. So I would highly suggest that you go get our course for $50 on the 7 phases of detoxification and start going through that. You have to go through all these phases of detoxification, and you really have, in my opinion, have no business doing chelation until you've dealt with these other 6 phases of detoxification. Also, getting genetics done would be a good thing to look at too. I am 67 and not on prescription drugs, though take several supplements for prevention. Can you suggest any supplements for overall health? I want to make sure I'm not missing something that I need. Okay, so I'm a big fan of getting your nutrients through your food. Okay, so I know that the very term supplement means you're supplementing your diet. But the best way you can, be healthy is to prevent disease and to make sure you're having a good diet, that you're not causing inflammation. So I don't think that, in one sense, I don't think that everybody just needs supplements, okay? And I don't think everybody needs to be taking supplements all the time. So, but in another sense, I realize that it's very difficult to get all your nutrition through your diet, especially as we age. Our food has less and less nutrients in it. Even organic food has, there's been studies done, it has far less nutrients than organic food did 50 years ago. So that's just the facts. So what do you do to try to supplement your diet? The best thing is through whole food type nutrition. I like greens products, just in a general whole food supplement. Most people are deficient, or a lot of people are deficient in minerals. Taking a good mineral product um, can be beneficial. And I think I have a blog post on what is a good mineral, because poorly chelated minerals are actually bad for you. So look at our blog about different minerals and try to how to recognize a good versus bad mineral supplement that's on the market. Um, and then deal with the causes of possible morbidity that you have. So if I have issues with my gut, you deal with why do you have issues with your gut. If you have other symptoms, heart issues, cholesterol issues, things, you want to deal with why you have those things and address those things. So I like to get specific and I like to do testing. So, um, but just from a general standpoint, maybe taking a whole food nutrition, in like a whole food greens first type supplement would be the first thing to start with. But again, I'm cautious to even recommend that, because if a person has different food sensitivities, sometimes you can't be on that thing. So, but that would be the most general answer I could give you with that one. My 3-year-old contracted Lyme's disease that we discovered from having a fever, fatigue, and numerous bullseye rashes covering his body. Is there still considered an early phase where 14 days after doxycycline is enough? So I think the question is 3-year-old with Lyme, um, 14 days of taking doxycycline, or 14 days after after figuring out when this person got the tick bite, therefore when they were exposed to the Borrelia. Um, so, but the truth is, so the answer to this is that a person can move from acute to chronic phase literally overnight. So most people it will take weeks to month for them to move to from acute to chronic phase. And for those who don't understand that terminology, let me explain briefly about Lyme disease. So Lyme disease is from a tick bite. You get Borrelia burgdorferi and possible co-infections that enter that person's bloodstream. That bacterial infection in the bloodstream is going to cause um, infectious type symptoms, acute infection type symptoms, typically, like this person said, fatigue, flu-like symptoms, fever. On some people, it will show a reaction in the skin, and the typical reaction of Borrelia in the skin is a bullseye rash, though most people that get Lyme disease never get a bullseye rash, and a lot of people that get Lyme disease never show acute infectious signs. So it's actually a blessing that you get these acute infectious signs and or the bullseye rash, because it's easily identified. Yeah, I think what a person should do if this happens is that they should start on an antibiotic, and the most common antibiotic used for this is doxycycline. Doxycycline, though amoxicillin can be just as effective. The typical treatment from a Lyme literate doctor with doxycycline is going to be 30 days of treatment. Does a person need, if the question is, does a person need to continue um, the whole 30 days? If the answer is no, um, that is just what's recommended uh, by the medical establishment. I've had Lyme disease at least twice, I think 3 times, and I took amoxicillin for it, and I only took it 2 days one time, 3 days another time. Some people say that's foolish because you could leave chronic Lyme um, uh, in your system. It worked for me. I'm not a big fan of taking uh, antibiotics for long term. So, but everybody's different. Of course, I never take antibiotics, so it works very well for me. And you'll know if you have a bacterial infection, if you take antibiotics, then you feel about 80% better um, soon after you take it. So, um, if the question is that, can you stop after 14 days of antibiotics? That's something you're going to have to discuss with the prescribing doctor. If the question is, did we catch it in the acute phase after 14 days? Um, Everybody's different. So I've had people that have taken antibiotics that felt 100% better, stopped the antibiotics after a full course of antibiotics. After a course of time, 2 weeks to 4 weeks, they start their symptoms all over, do the antibiotics again, knocks it out, and the whole course of antibiotics stop. After a few weeks later, comes back again. Then you know the bacteria has gone in the cell. So the difference between acute Lyme and chronic Lyme is acute Lyme, it's still in the blood or it's in the tissues, but in the extracellular space. It's not inside of a cell yet. So once a bacteria goes intracellular inside of a cell, antibiotics aren't going to kill it. Your immune system isn't going to kill it either. So it can protect itself by hiding inside of a cell. There's multiple other ways that different bacteria like Borrelia protect itself and hide and mimic as your normal flora, but we won't get into that right now. But if it once it goes inside of a cell, now you by definition have chronic Lyme, or what I call phase 2 Lyme. And those are the people that may go on long-term antibiotics historically for a year or 2 years to knock it out, because every time it comes outside the cell, an antibiotic is there to kill it. It can be very detrimental to all sorts of different body parts. Certainly your microbiota is affected horrifically by doing something like that. But that's when using a right machine is a key component. And then there's phase 3 Lyme, where your body is making antibodies um, against self-tissue, many times in response to the Borrelia in that tissue. So that's the way your body's trying to kill the bacteria. So if I understood that question correctly, gave you two answers, depending on how I can understand that. Hopefully that helps. Time for a couple more questions. This one came in. My daughter has been experiencing foot drop. Not all the time, but especially at times of stress. What could be the cause? We are getting no answers. So for those who don't know, foot drop is when a person might be walking and their dorsiflexion, so their toe coming back towards their leg, doesn't function properly, and the foot kind of just drops and they could trip. So usually a person that has, if you have foot drop, you're going to often have falls. That's a form of ataxia. So ataxia is dysfunction of motor function. Motor function means muscle function. So with a young girl having this, the first thing you should think of is gluten ataxia. So gluten ataxia is a form of ataxia from gluten sensitivity. So gluten found in bread, wheat, spelt, malt, barley, and the protein is gliadin. So the person has a sensitivity to gliadin. They have gliadin antibodies. They eat gliadin, it causes inflammation, and you have a gluteomorphine reaction. You have gluteomorphine receptors in the gut to the brain, and you're going to have inflammation in the brain. And if it's inflammation at the motor center, in the frontal motor center, which is this part of the brain here, you can end up with ataxia. Long story to tell. There's different reasons why a person can have ataxia. A person can have ataxia from other inflammatory conditions in the brain. Post-concussive syndrome is another reason why a person can have ataxia. Alcohol consumption causes ataxia. Uh, the list goes on and on. But the most common for a young person would be gluten ataxia. So getting her completely off gluten. And if this, I don't know who this person who asked this question is, but if this person said, well, she is off of gluten, then you'd go, is it times where then I would deal with the inflammation of the brain. And also I would do some investigation, do some lab work to find uh, gluten cross-contamination things. So different cross-contamination foods with gluten. Most common would be like corn and dairy and rice and different things like that. You could test for those. So if you have, I think that's a Cyrex Array 4 test to test for that. If you're not off of gluten now, then for sure you just start with that. Go completely gluten-free. Um, that's most common. I've seen that multiple times. So it's not an uncommon thing. I mean, it's when you have a form of ataxia named after gluten. Okay, it's a common thing. For a year now, my CEA has gone up about 10 points per month, but this last month it dropped 10 points. I was very curious to know if this is a good sign or can fluctuate like this. Well, your CEA, so CEA is a tumor marker test. So that's not something you would normally do. So this person must have a diagnosis of cancer, and they're monitoring their cancer using tumor markers. Um, if your CEA has gone up 10 points per month for the last um, it doesn't say for the last, but that would be definitely a concern for me, and you'd want to investigate further what is causing that. If it's dropped 10 points this last month, of course, that would be something that's encouraging. However, there's different reasons why a person's tumor markers can go up and down other than the growth or the diminished growth of a cancer. So if a cancer is being destroyed, if a person's using chemotherapy, your tumor markers can go up. So if you have a high degree of cancer cell lysis, can raise your tumor markers. So you'd want to be aware if you're doing chemotherapy. If you're not doing chemotherapy, well, CEA is going up, and that should trigger you to look at other things. Remember, there's no perfect lab, there's no perfect test, but every lab, every test gives you clues. So the clue that you glean from elevated tumor markers is that the possibility of cancer growth. So you'd want to look at talk to an oncologist, your oncologist, and see if there's a PET scan or CT scan or MRI that's in order, so you can monitor growth. Plus, you look at other blood markers too. Hopefully, you're doing a CBC to make sure that you don't have anemia, which is probably the most common thing that you're going to see on a CBC with a cancer patient, especially if cancer is growing. It's going to be a worsening of an anemia. Secondly, on a complete metabolic panel, you're going to want to look for your alkaline phosphatase and your calcium levels. Make sure those are not going up, because that could suggest metastasis to bone, or albumin, total protein levels going down. That could suggest some ominous signs as well. So you want to look at other things as well. Anytime you look at a test number, you look at it in light of other tests and other objective findings, as well as other subjective findings. I've had patients where tumor markers are going up, but they feel better than they've ever felt in their life, and they're just not going to worry about it, and they seem to just be fine. And then when they do go in for other objective testing, there's nothing else that's showing. So even doing an alternative approach can cause cell lysis of the cancer cells and can raise tumor markers. So, yeah, there's other things you want to look at before you can have a complete answer to that question. I think we have time for one more question. I tested high in mycotoxins. What should I take to kill mold in my body? We've had these questions a lot because it's a misunderstanding of what a mycotoxin test is. Um, if you do go back on our website and look at our blog and search just the word mold, there's multiple blog posts about mold, and I go into detail in some videos on what mycotoxins are. I think that will help you. But in short, a mycotoxin is a toxin that a mold produces. It's not mold itself. So when I do a mycotoxin test, so I do a urine test, that's what typically a mycotoxin test is, and I test high in mycotoxins. That does not mean I have mold in my body. So mold is a living organism. It's a type of fungus. It's a living organism. Living organisms will give off toxins. So if I have a living fungus in my body, it's most commonly going to be in my lungs, and I can have that. But that's not mycotoxin. That's not going to, necessarily. It's almost never going to give a mycotoxin elevation in the person's urine. A mycotoxin is something that you pick up from either eating foods that have mold in it. Let's say peanuts. Okay, peanuts or corn, popcorn. Um, corn is prone to having mold in it, and the molds produce mycotoxins, and then we eat them and ingest them, and those mycotoxins circulate in our blood. They're poisons. They're toxins. They're not living things. We can pick up mold, mycotoxins. Very commonly, we can pick up from moldy buildings. So we get mold in our house, so we're breathing in these mycotoxins. Mycotoxins are produced by that black mold that's growing in your bathroom. So, and we breathe those mycotoxins in. Mycotoxins are highly toxic. They're carcinogens. Most of them are strong carcinogens, and they need to be dealt with. The mycotoxin test is a good test to test for, and you have to deal with those mycotoxins and to detoxify them. So how do you get rid of them? Well, you're not killing mold in your body. Again, you're detoxing these toxins called mycotoxins. So how do you detox any toxins? You support all the detoxification pathways. Make sure that you're having daily bowel movements. Make sure that you're binding stuff, taking a binder, so you're binding stuff in the colon so you're not reabsorbing it. Making sure your gallbladder is healthy. You can use hot packs over your liver gallbladder to help with that. Make sure that your phase 1, phase 2, phase 3 pathways in the liver are open and healthy. Maybe getting a genetic test done to see the health of those would be beneficial. And then you're starting to chelate mycotoxins out of your body. You're using a chelator to grab onto things to pull it in to the bloodstream, and then when it goes into the blood, it has to go through the liver, and hopefully you've dealt with or are dealing with phase 1, phase 2, phase 3 in the liver. It's going through the liver into the bile, it's going to the small intestine to the large intestine. Hopefully you're using a binder so that you're not reabsorbing these things and that you're depositing them in the toilet. So the ultimate goal of detoxification is getting stuff from your body into the toilet. So the more and the better, and the better rate of detoxification that is happening in your body, the better you're going to have subsequent tests of toxins be closer to normal. But of course, you have to address, the exposure. So if you're not addressing the exposure, you could do everything that I just said. And if your rate of toxification, meaning your exposure to toxins, is greater than your ability and your rate to get them out, well, you're just not you're going to be a sick puppy. So you've got to deal with, whenever we do a mycotoxin test on someone that's elevated, I always suggest you test your house for exposure. Because if you got mold in your bathroom that you don't see, maybe it's behind the wall and you're breathing it in all night while you're sleeping, and every time you're in that part of the house, well, you're just going to kill yourself. So there's no way you can detoxify it fast enough to make yourself better. So you need to deal with that. All right, that's the time we have for today. I did mention multiple times of our website, and I'd highly suggest that you go to it. We have well over 1,000 blog posts. Most of them have videos dealing with a lot of things that you might have questions and you didn't get your question answered today. So go to our website, connersclinic.com, CONNERS clinic.com. Go to the blog and you can search for whatever topic you're looking for. Also, this Holistic Health Hour, we have a different website for that, the holistichealthhour.com, holistichealthhour.com, not the holistichealthhour.com. And you'll see all our past episodes, and they're well indexed. And you can even see the questions. It's very well done. All right, thanks for being with us today. Make sure you go to that same holistichealthhour.com and ask your question too. So you can post it right on a form, and you'll probably for sure get an answer. All right, God bless everybody. Have a great day, and we'll see you next week. Bye-bye.